Dentistry in General Advocacy Coalition presents 2025 ADA's House of Delegates Special Edition. Resolution 301. Imagine being a practice owner fighting to access your own patient's records, only to hit a wall of deliberate obstacles, hidden processes, restrictive gateways, and fees for something that should be yours by right. This isn't convenience, it's data hostage-taking. Vendors leverage control to trap dentists, turning routine data migration into a financial and operational nightmare. Dentists should never have to beg or pay ransom for their patients' health information. This is why certification cannot be symbolic. It must guarantee full, direct, and cost-free control of data, with export tools so transparent and usable that no vendor can hold a practice hostage ever again. Resolved, that the American Dental Association establish a voluntary ADA certification program to identify dental software platforms and imaging systems that meet defined criteria for security, interoperability, regulatory compliance, and data ownership. Resolved, that certification under the ADA certification program shall require the ability to export all practice and patient data in clearly labeled, structured, and non-proprietary formats, such as CSV, JSON, XML, JPEG, PNG, STL, MP4, or other common formats, with full access to the database schema or dictionary. This export functionality must be directly accessible to authorized users within the software itself and must not require vendor intervention, support tickets, or additional fees. Resolved, that certification under the ADA certification program shall require for any modules used in diagnosis, treatment planning, or image processing, current FDA Class II clearance under CFR Title 21, Section 892-205D is required. This includes, but is not limited to, capturing images, controlling intraoral sensors, and performing advanced functions such as segmentation, 3D visualization, or diagnostic measurements. Resolved, that the Task Force on Technology Certification shall develop and publish a standard export schema or schema guideline to accompany certification requirements, which vendors may either adopt directly or provide a usable mapping crosswalk to. Resolution 302. Patients deserve to know exactly who is behind the care they receive. Yet too often, the true owner or controlling management company of a dental practice is hidden from view. When the same entity operates multiple locations under different names, patients can be misled into thinking they are switching providers when they are not. This lack of clarity erodes trust, obscures accountability, and creates unnecessary barriers for both patients and employees seeking to address concerns. By making ownership and management disclosure a visible standard practice, the profession can restore transparency, ensure accountability, and reinforce ethical operations through the power of public awareness. Resolved, that the American Dental Association supports the requirement that all dental practices prominently disclose in outward-facing materials, including in-office signage and websites, the legal name of the dental practice owner and any affiliated management company, service organization that controls day-to-day non-clinical operations. Resolved, that the ADA encourage all state dental boards and relevant authorities to adopt model signage and website disclosure rules that promote transparency in ownership and management for the benefit of both patients and employees. Resolution 305. Dentists entering insurance networks are too often trapped in credentialing delays lasting from 6 weeks to 6 months, leaving patients shocked by unexpected out-of-pocket costs and practices paralyzed by operational bottlenecks. These unnecessary roadblocks discourage young dentists from moving to better opportunities, force them to remain in toxic or exploitative workplaces, and choke off their early career growth. Practice owners, meanwhile, suffer the financial and professional strain of watching new associates sit idle while offices struggle to expand. The result is a system that undermines access to care, burdens patients, and threatens the vitality of the dental profession itself. Resolved, that the American Dental Association create a task force charged with developing a model framework for provisional insurance credentialing of licensed malpractice-insured dentists actively applying to join a network, allowing such dentists to treat patients at in-network rates while full credentialing is completed. Resolved, that the task force review credentialing standards already in use in the medical field and consider best practices for dental-specific provisional credentialing guidelines, such as a 15-day eligibility window with completion within 60 days.